Hello now. How are you
Um,
doing?
I'm doing good. How are you?
I'm good too. My name is Dr. Hamza Yusuf, and I'm going to be your guide to help you make your diagnosis.
Okay.
So I'm going to switch the camera now. You should be able to see your patient and ask all the questions you want to ask. Okay?
Okay.
Yeah. So that's your patient, and we can go ahead.
Okay. Hello, I am Dr. Nyle. I'm going to be helping you today. Before we get to talk about your symptoms, I wanted to just ask you a few questions about your personal life. So, what's your name?
Wait, me is number lafiya. Okay, the name of the patient is Jawad.
Okay, Jawad.
Yeah.
Um, Miss Jawad, how old are you?
Wai shekaran shi na? He's 3.5 years old.
Oh, this is about her son. Okay.
Yeah.
Mm. Where do you guys live?
Wai a ina kuke zaune? Ina ne anguwanku? Okay. They live at Makama Street in Bauchi State, northeastern Nigeria.
And for your house, what does your house look like? Like, what's the environment around your house?
Okay. Wai ya yanayin gidanku yake? Ɗaki nawa ne? Eh, mata nawa ne mai gidanka yake da shi? Ko biyun yara nawa? Yara goma? Oh, okay. Okay. They actually live in their self-owned apartment. The family setting is polygamous in nature. They have there are two wives, and she personally has three other children, making a total of four. And the other, her co-wife, has six children, so they have a total of 10 children in the family. Pretty
Oh,
large family, right?
okay.
Yeah.
And has anybody else in the family have been having these same symptoms as your son?
Wai akwai wani wanda yake da irin wannan ciwon a gidan?
No.
Okay. Yeah.
So now I'm gonna ask you about the symptoms that your son has been having. So what are those like?
Wai me da me yake damun yaron ki? Mm, mm. Okay. Hassan has been having this fever for the past 2 weeks, and there's also associated history of cough.
Okay, so this fever, is it continuous or is it off and on?
Wai wannan zazzabin yana nan ne ko da yaushe ko yana zuwa ya je ya dawo. Eh? Eh? Hmm. Okay. The fever was initially continuous, but later it became on and off. It's usually relieved when she gives the child some over-the-counter antipyretics.
Okay, so you said he had a cough. Is the cough with mucus? Do you see any mucus in the cough?
Okay. Wai wannan tarin akwai wani yana fitar da kaki ne? Oh, okay. Okay. She said the cough is actually a wet cough, and maybe because he's a small child, that is why he usually swallows the sputum. So she doesn't usually seize the sputum, but it's usually a wet cough for the child.
Okay, so
Okay.
do you feel like your son has like a sore throat? Does he touch his throat a lot? Like he's in pain?
Okay. Wai kina ji kamar yana cewa idan yana haɗiye abu, kamar yana masa zafi ne nan? Okay, he doesn't have any sore throat.
Okay. And do you guys have like maybe mosquitoes in the area, or do you have a way to protect yourselves from mosquitoes?
Wai kuna amfani da kamar maganin sauro ne ko kuma akwai sauro sosai a gidan?
No.
Hmm? Okay. Eh? Yeah, okay. They have some mosquitoes around, but they sleep under an insecticide treated net, and they also use insecticide.
Okay, so do you feel like he has a runny nose?
Akwai majina yana zuba a hancin shi. Yes, he does have some runniness.
Okay, and does he have any chills or maybe some stomach issues?
Okay. Wai ya akwai ciwon ciki ko kuma yana ji kamar wani kakarwan sanyi ko na abu? Mm. Okay. She says he does have some chills occasionally, but he
Oh,
doesn't have any stomach issues.
okay. And when do you feel like this happened? You said 2 weeks ago. Did something happen before those 2 weeks where you saw where he was sick after this, like an event or something maybe? Like you saw something happen after the event and he started being sick?
Okay. Wai akwai wani abin da ya faru ne kafin ya fara rashin lafiya ko ba abin da ya faru? Okay.
No.
There's no any event that actually preceded the illness.
Okay, so for some tests, I want to run a swab, a throat swab to see if he has an ARI.
Okay.
And I think that might be it.
Okay. So actually, I'm sure you can see the child coughing, right? And you can see he's having a paroxysm of cough.
Hmm.
You can see. So now, after the paroxysm of cough, he usually has an inspirational loop, and occasionally, okay, yeah, after the paroxysm, I'm sure you saw the cough, right?
Hmm.
Yeah. So that's what is called a paroxysmal cough.
Okay.
And yeah, and it's usually associated with a lower respiratory tract infection. Okay.
Um,
Yeah. So, so you can go ahead and prescribe some treatment for your patient. Would you?
I'm sorry, I can really hear you.
Yeah. So we actually think that the child has a lower respiratory tract infection.
Oh,
Okay.
so it's not an ARI.
Yeah, most likely a pneumonia or even pertussis. So would you like to prescribe any treatment for him for lower respiratory tract infection?
Oh, lower our respiratory infection. Um, did we do a test to see that if it had well, if it's lowered, so an X-ray?
Yeah, perfect.
Okay.
So we actually did an X-ray and it showed some patchy infiltrations in the lung fluids. So
Okay.
that is consistent with pneumonia. Okay,
Pneumonia. So
exactly.
I would give something for the fever, some medicine for the fever, and for the pneumonia, I would also give some like supportive care, some hydration, definitely some rest, and definitely like some hydration for
Yeah,
the infection.
yeah, great. So would you like to also add an antibiotic for him?
Yes. Yeah.
Great, perfect. So I'm going to translate exactly what you said to your patient, okay? Right now.
Okay.
So when tana tunani kaman uh, the lower respiratory tract infection ne ke damun yaron. Bi ma'ana kaman yaron yana da pneumonia, kin gane? Yeah, so za a ɗan bashi wasu magunguna har da antibiotics ko da kuma maganin zazzabin. Wato bata sani ba, uh, okay, I've explained what you actually said to the patient. I don't know. Do you want to talk to the patient about some preventive measures in case to prevent future occurrence?
Yes, for some prevention measures, I would definitely say coughing, like staying away from people who might have a sickness, coughing with your hands, washing your hands, making sure you're like clean, like you're definitely washing,
Yeah,
making
great.
sure you're not spreading germs.
Yeah, great. That's great. So, wai kana so ya kare kan shi saboda irin wannan tarin nan gaba yake zama a inda ba masu tari a kusa ko? Hmm? So, abin da take so kenan ai. Yeah, so she actually appreciates everything that you said. And we are also very happy with your performance because you were very thorough in the, the questions you ask the patient. You that way you can hardly miss any diagnosis. So well done, you did a great job. I think you can wave your patient goodbye if you don't have any other questions. So we like again. Yeah, so I appreciate. So have a nice day, okay?
Okay.